Now, one last question before we wrap things up. If you could give the audience 3 pieces of advice to live a healthier and happier life, what would that be?
I think you just have to, you can't sort of ignore basics.
Yeah.
You got to eat an organic diet. We find most people, if they do sort of paleo-ish, they do well. Most people have trouble with grains. They have trouble with legumes. So I start everybody on that. It's sort of an autoimmune paleo diet. Meat, fish, eggs, fruits, vegetables, nuts, and seeds. That's your diet. Okay. If it's in a package, don't buy it. You want fresh whole food and you want organic. Okay. You want to make sure that you have a bowel movement every single day. There's nobody that's normal that doesn't have a bowel movement at least once a day. It should be satisfying. It should actually be pleasurable. And the feeling afterwards is that you feel empty. There's sort of an empty, nice sensation in your body after you went to the bathroom. And I think there's just no way around that. Now, some people need colonics, or they need enemas, or they need magnesium, or they need, bowel softeners, to get them going. But you got to end up with, that's where you want to end up. You got to be outside and you got to move your body and you got to get some sunshine. And then you got to sleep enough to keep your body in a rest, so that you're rested and that you get good quality sleep. And, you've got Oura rings and you've got all these devices that you can do to track your own thing. And I was an emergency room doctor. Before that, I was a pediatrician, and I was on call every third night. And I learned to live on 5 hours of sleep. And when I started tracking my sleep, I found out that my sleep sucked. Like I wasn't getting restful REM sleep, and I was wearing myself out too fast. So I decided, okay, I'm going to do whatever it takes so that I can get good scores on my Oura ring for my readiness and my sleep. And I made myself, it took some months, that I'm going to turn the lights off at 10, and I wake up about 4:45. And if I was awake before that, I was going to lay in bed until I teach my body that it's got to have this much sleep. And I eventually did it so that I can get good restful sleep, enough hours so that I can get up and I can train for a couple hours and I can go to work and I can do what I like to do and my body feels good and it's healthy and I got good scores. So that makes me feel better. So, that's one of these other things where you can track this stuff and you can do what's right so that your body does the best. And then I think hooking up with doctors that are interested in your health. And there are all kinds of them. There's naturopaths and there's chiropractors and there's nutritionists and there's practices like yours and like ours. But you need a coach because your regular doctor has no idea on any of this stuff. And you can be coached and to sort of alter your lifestyle so that your health can improve. And I think if people do that, it isn't very complicated. I think there's one other piece of this is that if you have negative people in your life, that you find more positive people when you spend time around them, because you're going to be the sum total of the people that you spend time around.
Yes.
And, the people who have a positive outlook and they're happy when you're doing well. If you have friends that are critical of you and that aren't happy when you're doing well, they're not very good for you. And you should just, I wouldn't create a war, and it might be your mother-in-law. So you have to gently do this, where it's a good roads, good weather approach. But the people that you want around you they're going to help you and you're going to help each other. And this is the community. This is the, the group. This is the, like I'm sure in your practice, where, that's what I'm trying to create in my practice. Like every one of these people are vibrating at a level up here instead of down here. And the patients, like every day, say to me, I don't know how you do it. These guys, they care about me. They're positive. They want to help me, and I know it. And I don't get that feeling from my regular doctor or when I go to the hospital. Because we are trying to create an environment and a culture here because it's a healing culture. And then people come into a healing culture and their own vibration raises. And then their cells get better. And then they get better.
Yeah. Incredible advice. And it is so true that, I posted about this the other day. Toxins aren't just harmful chemical substances. They can be people. and you need to get toxins out of your life. And that means getting the wrong people out of your life. Otherwise, you won't get better. And I think that's a big part of it too. We talk so much about root causes. We don't look at the relationship sometimes we have as root causes. It could be you're not with the right person in your life. It could be that you have an old relationship you're holding on to or have some trauma with. That's the cause too. So finding a doctor such as yourself, a clinic such as yourself, is so, so important to get to those root causes and truly correct what's going on and regain your health.